All right, good morning. This is Sonia Bingaman with the State Council on Developmental Disabilities with the Sacramento Regional Office. And we are going to have our weekly Tuesday chat where we invite a member of the community or organization or a parent member to just chat with us, answer some questions, and then open it up to all of you to ask questions as well. The State Council Sacramento office covers 10 counties surrounding Sacramento, and those include Sacramento, Yolo, Yuba, Sutter, Colusa, Placer, Nevada, Sierra, Alpine, and El Dorado. So kind of a big circle around Sacramento, but we know there are people on the call from all over California, so welcome to all of you. And we think the information that we shared today and at most of our Tuesday chats is applicable to everyone all over the state. So you may have a different local provider, but the ideas are similar, so welcome to all of you for joining us. The State Council is established by state and federal law as an independent state agency to ensure that people with developmental disabilities and their families receive the supports they need. Through advocacy, capacity building, and systemic change, SCDD works to achieve a consumer and family-based system of individualized services, supports, and other assistance. During COVID-19, we're reaching into the community to find out what the needs are of people with disabilities and sharing that information with local, state, and federal agencies. We're also working to create plain language and other documents in Spanish and Chinese and other languages that will help people and their families to understand what's happening. Today, we're fortunate to have April Wick with Resources for Independent Living. In a moment, I'll turn it over to her to introduce herself. I also wanted to introduce Kathy Bryan. Kathy?
Hi there. Welcome, everyone. It's wonderful to have these chats, and we are so fortunate to have April joining us today. But I work alongside Sonia as the CPS2 in the office, and just grateful to be able to reach out to the community in this way. Thank you.
And Kathy will be helping out with the chat, so feel free to put any questions if you're having any technical issues or any questions that you want us to ask. You can use the chat box, and then also later we'll unmute you all and let you ask questions yourselves as well. All right, so April, tell me a little bit more about you, who you are, where you came from, and it kind of looks like you're come from outer space there, but landed on Earth, and about Resources for Independent Living.
Well, thank you, Kathy, for inviting me thank you, Sonia and Kathy, for inviting me to the Tuesday chat. I'm April Wick, and I'm the Executive Director of Resources for Independent Living, and we are a peer-driven advocacy and resource center for people with disabilities and older adults, and we serve Sacramento and Yolo counties. And I have been the Executive Director, it'll be 2 years in July, and I have been both a person with lived experience of a disability. I use a wheelchair, and I have been an advocate and worked in various capacities in the disability field since 2007. So I've been at it for several years. And prior to this, I was running the equivalent of a regional center in the state of Oregon. And then prior to that, I was in the Bay Area running a center that provided emergency caregiving support and wheelchair repair and non-emergency accessible transportation within the city of Berkeley. So I've had a lot of unique roles in my career and seen a lot of different perspectives. And I live here in Sacramento. I live in Midtown with my husband and our dog, and been sheltering in place for the most part, like most of all of us have. So that's a little bit about me.
And how about Resources for Independent Living? What does it do? Who does it serve? What is its mission?
So Resources for Independent Living has been around since 1976, and our mission is to increase the socioeconomic independence of people with disabilities through peer-supported services and advocacy. And we are funded by mostly by federal grants, and also some state pass-through dollars. And we are mandated to provide 8 core services. So we provide information and referral, peer support, independent living skills training, advocacy, We also provide transition, which is a three-pronged service. We provide transition to home from institutions. We provide youth transition services, and we also provide diversion. So we provide support so that people can stay safe in their homes. We also have an assistive technology loan closet with over 200 items for short and long-term loans, such as, the one I always talk about is there's a sock that you can use that has a pulley to help people who have had strokes, for example. And we have our youth group here, Independence Counseling Sacramento, where we do service learning and mentoring. And we also just launched our newest program is something called Quick Match, where we're able to use it's sort of like the Facebook of caregivers, where we interview and onboard caregivers onto a registry that is a searchable registry for consumers. And so we do a lot of consumer matching. We just launched that service, but that is one of the core services we're mandated to provide. So prior to Quick Match, we were just kind of doing it more informally. And we also do housing search assistance. And what that means is that we help people understand how to locate affordable and accessible housing, what questions to ask, how to get weaved in and out of those systems, helping people, get on the Section 8 housing lists, for example.
Wow. We'd like to do a training on each of those topics.
Yeah.
So that's amazing. Actually, can you just talk a little more about the Quick Match? Because I know that's such an issue right now with direct service providers. Some of them maybe got sick. Some of them are afraid to go into homes to work. In some cases, the individuals and their families don't want workers coming into the house right now. So it's kind of all over the map, and people are sometimes looking for backup staff or trying to limit the number of staff coming in. How can somebody access that Quick Match, and how do they access it through you?
So all they have to do is give us a call or email Angie. So Angie Guerrero is our Quick Match coordinator, and I can provide all of that information to you for you to distribute. I'm not sure what the best way is on this platform, but right now we have been operating 100% virtually since mid-March, and so we're providing services on phone, email, and Zoom. But if you call our main line, which is 916-446-3074, you will receive a call within 24 hours, and you can ask to speak with Angie. And like I said, Quick Match is new to us, and so we don't have a lot of caregivers on the platform yet, but that doesn't mean that Angie can't work with you one-on-one and do some peer support. That's one of the other core services that we provide is peer support. So she also will teach people how to hire caregivers, how to stay safe when you're interviewing them. And this is Quick Match is a way for them to know that we've vetted them. They have to have at least 6 months of experience, and they have to have at least 3 references, and they have to answer our survey questions correctly. And we also will ask them about all of their skills, what they will do and not do, and their experience and their background, so that when we give the names to the consumer, they know that a trusted partner has vetted them. They're not our employees; they're still their own independent contractor. So the client our consumer is the employer of the caregiver, and so we educate them on how to be a caregiver employer. And we've definitely been in touch with the public authorities as well, to the other point to your question, to see what they're doing about backup services as well during this time.
Okay, so people can just call your office and talk to Angie if they have questions.
Yes.
Because I know the backup services with the IHSS is something that we've been sharing information about, but also wanting to confirm that really exists in all of our counties and areas. So the idea is great. We're not sure if it actually exists in every county.
Yeah, it's supposed to exist in every county, but as we know, some services are better than others, and so that's why we have to advocate for people with disabilities. I do know that, I know this is a statewide call, and so Centers for Independent Living, there's 29 of us in the state of California, and all of us have the same core services. Some of us do not use Quick Match, but we all have to provide caregiver referral. And I know that particularly some of the counties in the Bay Area have actually used Quick Match as a backup service. So if you're calling from the Bay Area, you may want to call SVILC or the CIL and just see how they're utilizing Quick Match as a backup service during the pandemic. And I also want to mention too, you had asked a little more about RIL. So we are consumer driven. 51% of our staff and board are legally mandated to be people with disabilities. And I'm proud to say that 89% of our staff and board are people with disabilities. So we exceed that mandate. So several of us have some type of disability. And we serve people with all ages and all types of disabilities, and all of our services are free.
Thank you. Now, are you vendored with the regional centers?
We are not currently vendored with the regional center. I know that some independent living centers do provide ILS training and are vendored through the regional center. But when I say independent living skills training, what I'm talking about is that every Tuesday we have classes where we teach people with disabilities different skills. Like we have a healthy eating class, we have an exercise class, we have a class on civil rights and how to access those rights. We have a fair housing training we do every year. So we are not an ILS provider in the way that many of you on the call think of what an ILS provider is. It's a little confusing that a lot of us use the same words. Mm-hmm. And our youth program has a pretty comprehensive independent living skills training binder where we talk about travel training and how to disclose your disabilities to an employer if you're getting your first job, those kinds of things.
Okay, so it's not the in the home teaching cooking and shopping and budgeting,
right.
and hands-on training with that. So it is a little different, but somebody who is getting ILS services from the regional center, could they also access some of these other skill training opportunities that are provided through Resources for Independent Living?
Oh, absolutely. We absolutely welcome that. In fact, we're seeing a lot more consumers signing up for classes to augment what they're learning at Alta and the other regional centers. It's really exciting to see because people with intellectual and developmental disabilities is actually, it's an underrepresented and underserved group among the Centers for Independent Living across the state. So we're all trying to find, unique ways to be of value to that group of people. So a lot of people who are also served by Alta are a part of our PICS youth group as well. So that's exciting. So there's a lot of things that we do that can complement what they're getting at the regional center.
And would RIL be considered a generic resource? Do you know?
What does that mean exactly?
Yeah, so for regional center is considered a payer of last resort, which means for any services, whether it's medical, healthcare related, school, education related, so education, medical insurance, those are all you have to go and request services and supports from those entities first before you would go to the regional center and ask for some assistance or some help to pay for a therapy. If your insurance doesn't provide it and they give you a notice of denial, then you could go to the regional center. So generic services are basically services in the community that are available to anyone to access. So the public library and SSI, SSA, just any services, DMV, getting your license, any other services in the community that are open to anyone. And so the goal is that regional center services, well, in law, they don't supplant or take the place of any of those services. So, for example, a family might say, well, my school district's not providing a great, really good educational program. We want the regional center to pay for it. Well, the regional center can't because education is mandated to pay for education services until the age of 22. So, so generic resources or any other service in the community that is open to serving, anyone. So for some of those skills, it seems like some of the things you have that folks could access those services to learn some skills rather than going to Alta and requesting, or regional center requesting funding?
Yeah, I mean, we're definitely, we are limited to serving people with disabilities. So the people who walk through our doors who would benefit from our services are people with disabilities. And you have to self-identify as a person with a disability. So in that sense, we're not general in that we're like the public library where any general population can come in. Of course, if they do, we'll still give them information and educate them about our services, because either you have a disability or you know someone who does. I do see in the chat box that Elena said that we're considered generic resources, so that's good to know. So we're always, looking for ways to partner, and we want to make sure that anyone who could benefit from our services knows about what we do. And we believe in a no wrong door. So if someone calls and says, I'm an Alta Regional Center client, we're not just going to say, well, that's nice. Have a, go work with them. Like, we'll say, well, how can we, welcome to your center. How can we serve you? Because people with disabilities are basically the people that their ideas and their activism within the center is what makes the center what it is. So I work for them. So.
Right. So you mentioned calls that you get. Sorry, whoever's calling me, I can't answer the call. What are some of the calls that you do get? I know you get a lot of calls for assistance. What kinds of things do people call RIL for?
The number one service aside from information and referral is housing, and that definitely, I don't think it surprises anyone on the call, and because I think Sacramento was voted one of the top highest rents for their municipal category, and so the amount of affordable and accessible housing is very low. And so there's a lot of people out there who are looking for housing that can allow them to age in place, or that can accommodate their physical disabilities. And a lot of the stock that is available is older and not very accessible. So they call us and ask us, can you assist us with our rent, or can you assist us with making our house more accessible, or teaching me how I can successfully maintain my housing. Those are a lot of the calls that we get. And traditionally, we're not allowed to use our federal dollars for direct consumer assistance like rental assistance, but because of a grant that we received from the Emergency Food and Shelter Board, and as well as a generous donor, we do have a client assistance fund where we are able to provide a limited number of rental assistance every year to a set number of clients. So we're blessed that we have that fund available, but it's not the traditional bread and butter of what independent living centers do. It's mostly talking to the person and when they call about housing, and we have a very comprehensive housing list that's searchable. So like, let's say you can search for, a 1-bedroom apartment in this neighborhood, and say you have a service dog, you can enter all the things about yourself into the search field of our housing list, and then you're able to narrow down what's available. And then we have independent living specialists that will work with the person and talk with them about what they need to do to get prepared, how to fill out the application, how to present yourself to the landlord, how to take care of any credit or past eviction issues. And then we can also talk with them about resources we may have to help them make their housing more accessible as well.
April, I don't think I asked you what counties that you serve.
We serve Sacramento and Yolo counties.
Okay.
So those of you who are on the call, don't stop listening, because as I mentioned earlier, there are 29 independent living centers across the state of California, and there's independent living centers everywhere across the United States and the world. So if you go to cfilc.org and click on Find My ILC, you'll be able to enter in either your address or your zip code or your county or your city, and then you can see which independent living centers serve your catchment area. So all of us serve a different catchment area. We all have our own unique staff and board. All of us are 501c3s. We're just legally bound to provide the same 8 core services. And then several of us also may provide other services as well with other grants that we may have received.
Okay, thank you. I also wanted to clarify, so if because I know there are parents on this call who have adult children who are looking to move out independently. If you have an ILS agency working with you that is funded by the regional center, let's say they're just having a hard time finding an affordable or accessible apartment, can the individual who's receiving services or the ILS instructor, can they call your office to get additional assistance? Say they've just hit all the roadblocks and they're not finding anything. Is that something that they could call your office and kind of collaborate to help find a apartment?
They definitely can. One of the things that I always share with people is that we're not a housing search agency, and that we have access to housing. We don't own or operate any housing, and so sometimes when people call, the expectations are a little bit higher, that they think that, you know, we're gonna be able to, we have some kind of in to help people find housing. But we do because we've been around for over 40 years, we do have a lot of relationships with local landlords, and so we are able to know when housing is coming up. Because a lot of landlords will feed us that information, and a lot of properties will feed us that information because they know that we have our housing list. So that keeps us at an advantage in that we can share with the person. I think one thing that sometimes when we receive calls from people who are used to being served by the regional center system, some of the things that we've come across is that sometimes the parent will want to drive the conversation, or sometimes the service provider will want to drive the conversation. So what we do is we want to work with the individual. The individual is our client, but we know that person comes from a family and circle of support. So there are some times when we're talking to the person directly, and we know the parent might be sitting right there, and we might say, well, John, what do you want? What do you want to do with your life? You know? And because we want to make sure that person, you know, gets used to being asked those questions, because, you know, our services are centered on the person and that person's choice, which may differ from what the family or the provider wants.
Yeah, that can differ. So what about COVID-19? Have things changed? Have your calls changed? And I also wanted to clarify the name of the person people should ask for in your office if they are looking for assistance with paying rent right now, or if you still have any funds in that special project or special program that you got access to right now. Do you want to clarify that? And I can type it into the chat box.
Yes, absolutely. So we have been operating virtually since March 16th. So we are not currently providing in-person services or drop-in services or classes. We hope to resume in-person services on a social distancing basis by mid-June. But we are waiting for some PPE, some personal protective equipment, to arrive for us to safely operate our office. But in the meantime, you can call our number that I gave earlier, that you can 916-446-3074. You can also email reception@ril-sacramento.org for general questions, and we can route you to the right person. And our website also lists our services and who to contact for each of those. So we did launch a COVID relief fund in mid-April. And thank you, Sonia, because you're one of the awesome people who spread that around. And so that we're able to get people to help through that. So I really appreciate that. So as I mentioned earlier, normally our 8 core services do not allow us to provide direct to consumer services, but Congress, through the CARES Act, allowed us to have a one-time allocation of what are called 7C funds. There's not going to be a test on this. It's one of the names of our grants. So basically gave us an additional infusion of grants that we have to use within 18 months to help the community through COVID-19. And so how that shows up for RIL is we're providing rental assistance and groceries and assistive devices to people with disabilities. It has to be directly related to COVID-19. So if someone calls and says, you know, can you help me pay my rent? They have to show some kind of COVID connection to be eligible for that fund. And we will help people with disabilities, or if there's a family member with a disability. So you can apply for your child or your relative, for example, and that person will just become our client. And we help provide up to $3,000 per household. And we have different breakdowns of what we'll provide. We'll provide up to $500 in assistive technology, such as, you know, adult diapers or things that have been panic bought, like gloves, distilled water, adult diapers, those kinds of things. And if the need to stay healthy and happy in your home extends past that $500, we may be able to leverage other funding and use some other funding we have available, like if they need a bed or a lift or something like that, we can talk with them about that. But for purposes of the fund, it's up to $500 from the fund for the DME stuff, and then up to $3,000 per household for everything. And then for the groceries, we provide a $300 gift card for an individual, or a $500 gift card for a family. And we have so far expended about $40,000 in aid since we launched the fund. So so what you have to do to access the fund is, like I said, do all the things I mentioned earlier, but the person who is the contact person is Jasmine. So she's our COVID Relief Fund coordinator. So if you call or email our office, ask to speak with Jasmine. And she's the person that screens all of the applications.
I wanted to ask about technology. A lot of adults and children, actually, with developmental disabilities who are now, as a result of COVID, I'm looking at Lisa Cooley right now, who could benefit from having a assistive technology or a device such as a tablet, so that they can continue to connect with the world, and especially individuals who are strong advocates and do trainings themselves and so on. Would a tablet or a device of some sort or connection be something that could be funded through that account?
So what we have been doing as far as technology is we have been serving people through our assistive technology loan library, as well as helping people connect to the Digital Access Project. The Digital Access Project is a program that could allow for free or low cost internet and devices. And so far we have not used the fund to purchase personal technology for people, but we are looking into ways that we can adapt the fund over time. So far, the most crushing need has been the rent and the food, but an eligible use of that fund, Congress did say that we're allowed to use that fund to provide technology to assist with the digital divide. We just haven't rolled that out at this point. We're able to serve what the questions that we've been getting for technology with the statewide digital access project, as well as the assistive technology loan library. We do have several tablets that we can loan out. So far the need has not expanded beyond what we currently have, but we're open to, we want to be cognizant of the needs of the community, and the digital divide is a really huge issue. I know that the city just said that the city of Sacramento just said that they were going to start providing free Wi-Fi. I don't quite know how that's going to be rolled out, but that's exciting. So we're hoping to leverage as much as we can the pre-existing services and connecting people with services that already exist that are underutilized by people with disabilities. And then if we need to, over time, we can adapt the fund if we see that that's a huge need that's not being met by others. Some centers are already doing that. Some centers are, one center is calling it tele-independent living, and they are using their fund to provide to provide tablets to consumers. So different centers are taking the allowable costs and using them in different ways, just depending on what their catchment area needs. And we determined that our catchment area needed the housing more than the technology, but.
Okay, well, after today, you might get a lot more calls for
Yeah.
technology, because we know it's a barrier for some, and it's also been incredible, an incredible gift to be able to connect with people who do have connection and do have devices or assistance, to continue to connect. So a lot of the People's First chapters and other groups have been able to connect that way, and it's been wonderful, but not everybody has the device. So
Yeah.
we will continue to refer them to you. Can you talk a little bit more about the ability tools? I know it's a program that Kathy and I spend a lot of time handing out flyers for and sharing at everywhere we go, because you know, there's a variety of devices, whether it's a hospital bed, wheelchair, tablet, laptop, reacher, adapted toys, games. And it's just an incredible resource that we tell everyone about, either work-related or in our personal lives. If they need something for a short-term loan, somebody just had a surgery or something, and they don't want to go out and buy all this equipment. So I'd love to have you talk a little bit more about that.
Yeah, so we're fortunate to be one of the grantees through the California Foundation of Independent Living Centers through their Ability Tools program. We actually call it the Device Lending and Demonstration Center. So we're considered a Device Lending and Demonstration Center, another fun wordy acronym for you, DLDC Center. And so we provide over 200 devices for shorter long-term loan for people to try out. And let's say they try it out and they want to purchase it. There is also a low-cost loan program that we can connect people with disabilities to purchase assistive devices. It's through CFILC and they have to apply, but we educate people on how to do that. We also have some equipment that we reuse. So sometimes we just received an additional grant to purchase last year quite a few crutches and manual wheelchairs and commodes and things like that, which those aren't the kind of, you know, like commodes. I don't know that you would want a commode that somebody else had. So we buy them and we give them away. We don't recycle commodes and stuff like those kind of personal things out into the community, but we have a reuse program where we do that. And we also just received a grant from the Department of Rehabilitation called Voice Options. And so this kind of goes back to your tablet question. If you have clients with speech disabilities and they give us a referral from a speech pathologist or a speech professional, we can work with them to use speech software on iPads, and we can do short and long-term loans of iPads where we teach people how to use that software. Last year, when the pilot was at CFILC, we did the pilot last summer and we served 45 people, and we hope to do it again with this second iteration of the pilot now that it's at DOR. So it was one of our more popular offerings. We served, and that was a way for us to serve a lot of people we hadn't generally served, like a lot of older adults who had strokes or other speech disabilities that they had acquired. And we'd also served a lot of young people who were not quite yet school-age children. I remember one of our clients was a little boy who had brain cancer, and he learned to communicate with his family through the iPad to say what he wanted, and that was really cool to see. So it's really cool that program is one of my favorite programs because, you know, it just helps people to remain safe in their home and also to be as independent as possible, which is our mission. And we also teach people, the cool thing is our assistive technology coordinator is also a person with a disability who uses assistive technology. So he is able to be a peer and say, well, this is how I use Dragon on my computer. Let me show you some tricks, you know, and so they can learn from someone who's been through utilizing the equipment instead of someone who may just kind of know intellectually about the equipment.
That's great. I mean, we really believe that you can't advocate for yourself if you don't have a voice. And unfortunately, there's a lot of people who haven't been given the assistance to have their voice. And especially now, some children went home when schools were closed and didn't get access to their devices maybe they were using in school. So, and they weren't able to go back in and get them. So some children might not have access to having their voice right now, and having to find alternative methods. So is that something that a school-age child, especially since school might not start till the fall, could possibly access something temporarily through you?
Yes, we actually have been serving some school-age children lately. We actually I know we gave a smart pin to someone who was using it in school. I mean, that brings up a larger issue though, where, you know, advocacy is one of our core services, and you know, even though we don't specialize in IEP advocacy the way that like the Warm Line or other agencies do, we still, as long as it's a disability related reason, we want to know those kinds of patterns so that we can advocate. Because if kids aren't getting the services that they need, you know, it's great that they can come to us and we can rent them a smart pen or whatever we rent them, but they have the right to have the things that they need for their through their IEPs at home. So we need to know about that so that we can all figure out how to best advocate for that person.
Absolutely. Switching back to COVID, are there new calls or issues that are coming up in the last couple months that you can share that you've seen?
You know, it's interesting. It's actually pretty heartbreaking because within the first, I would say 48 hours after, you know, the lockdown or the shelter in place happened, we received 14 calls. All of them were for people who were in their mid to late 70s, and they were all at risk for eviction. And so if you can imagine, you know, the people that we serve are people who are at the highest risk category for having the biggest disparate impact from COVID-19. And that increases if you're a person in a minority group. If you're Black or Latinx, you are several times more likely than a white person to die of COVID-19. And so if you were going to take our average client who we serve, it would be a Black male with a hidden disability living on less than $12,000 a year. So that person right there is the highest risk category for dying of this disease. And so we received a lot of panic calls from people who were getting evicted, and that would put them at risk for not being able to shelter in place. And we also received a lot of calls from people who couldn't get access to their regular equipment. Like a lot of people use gloves for their daily self-care, and those were being panic bought. Also distilled water for CPAP machines. People weren't understanding the difference between distilled and regular water, so just buying up all the water, but not realizing what that was going to do to people. So, you know, I think that this really shows a lot of the impacts in our society that affect people differently, you know, due to structural issues and systemic barriers, you know, with, you know, racism and ableism and sexism. They're highlighted through COVID. And so I really see COVID as sort of a wake-up call and an invitation for us to kind of, let's figure out how we solve these structural barriers that existed before COVID and are highlighted by COVID. And let's not miss that opportunity to create, you know, the world. I know it sounds sing-songy, the more inclusive world we want to live in, but it's really true. You know, I think, you know, we're seeing less people off the roads. We're seeing, you know, less climate impacts right now, for example. And so we have an opportunity to come, we don't have to come back and do business as usual, you know.
Thank you. I just put in the chat the email to send your requests for PPE. I'm not sure if I said it before or after we started the recording, but if you're an individual seeking PPE, masks, shields, or hand sanitizer is what we're expected to be getting in the next week or two, or an organization that could help coordinate distribution of those, please send an email to sacramento@scdd.ca.gov, and we will have you fill out a form and get on the list to get that distributed to you as soon as we have it. I wanted to turn it over to the participants to see if there are any questions for April. So feel free to just unmute yourself, or Kathy might see somebody raise their hand in the chat, but just opening it up.
I was wondering, April, I have a son with autism and also intellectual disabilities. I am his conservator. We want him to be as independent as he can, but he needs a lot of assistance. Would we be able to work with you? Our main thing is we're having a really hard time getting on the waiting list for Section 8 housing. There's we're in Roseville, and you have to apply to get into a lottery to then be chosen. And out of 5 years, I've only even been able to get into the lottery once. And I'm on a list. I get the alerts as soon as the window opens. And most of the years I can't even get him into the lottery. It's so jam-packed. And would you be able to help us with that? If there's something I don't know, some magic, of how to make that happen for him.
Absolutely, you can give us a call or send us an email to set up a appointment. I know that paperwork wise and service wise, there's a few things we need to do, since you mentioned you're a conservator. But that doesn't mean we can't talk to you or talk to him. It's just we have to document that and do a couple of things. But we can walk you through that. But one of the things that our independent living specialist does is we have 2 specialists on staff who have been with us for over 20 years, and they're very skilled at the housing piece. And like I said, there may not be any magic, but we do know how to kind of wind through those systems, and we can kind of talk to you about some of the things you might be missing, or some of those spots that you might not be seeing that we've seen over the years that we can maybe help you with. I never want to overpromise or overdeliver that we can just magically help people find housing, but we would advocate, and we've been successful at helping people wind through the Section 8 process and come to the end of it. So it is possible, because we've seen people do it. It doesn't feel like it is sometimes, because it's so many years that you're on the list, but it's worth it in the end if you can
Right.
get that benefit. So definitely that's one of our services that we could help with. And then for the youth piece, your child might be interested at some point in participating in our PICS program. And so we could tell you more about that also.
April, do you have a flyer on the PICS program that maybe we could share out with everyone later?
Yes, I will make a note to get a flyer for you. We've redesigned some of our flyers recently, and we just hired a new youth services coordinator. Her name is Emily. And Emily, I also want to mention, she's also fluent in American Sign Language, which is awesome. So I will ask her to see if she is ready with that flyer. We have some pre-existing flyers from last year, but I know she wanted to spice them up a little bit, make them more youth-centered. So,
what does PIC stand for? Because I just wrote PIC, but I'm not sure if that's correct.
Yes, it is. It's Peer Independence Counseling Sacramento, and we have a whole curriculum where we do mentoring and service learning, and we also partner with Sac City and UC Davis, and we do office hours at those institutions as well. It's designed for 14 to 28-year-olds, the PICS program, but we also serve all youth of all ages. So Emily is the name. Yes, we do have information in Spanish. Sorry, I should let you read.
No, you're good. You're good.
Yeah.
Go ahead.
I will go ahead and get that information for you.
Okay, thank you. We'll share that out. And Kathy and I, like we said, we take all of your flyers all the time and hand them out. And Kelly, just to clarify, you're in Placer County. So April, can you provide support to her even though she's not in Sacramento or Yolo County?
So for Placer County, the independent living center you want to go to is Pirs. It's PIRS. If you call us and you're outside of our catchment area, we will give you a warm handoff to the independent living center where you are.
Great.
So Pirs is where you want to go.
Okay.
Thank you.
Yeah, we did type that in. Raymond, is there any other anyone else that Kelly should connect with in Placer County?
No, I think Piers would be the best place to start, and they are up in Auburn, off of Bell Road.
Great, thank you. And Raymond often shares great information for Placer County that we share out with farmers markets that are free, and food resources and other counseling support and other services. So thank you for sharing all of that information, Raymond. We'll keep sharing that out for folks in Placer County. Any other questions here? Feel free to unmute yourself and go ahead and ask a question.
Has Resources for Independent Living ever thought of bringing some easy does it type services to Sacramento?
Hi, Lisa. It's good to see you. So
Good to see you too.
So Lisa, what Lisa's talking about is in Berkeley, and I used to run this program. Berkeley has a program called Easy Does It, and they provide backup attendant care, wheelchair repair, and non-emergency transportation to people with disabilities living within the city limits. And that is actually funded through a property tax measure that was passed in 1998. So every time someone pays a homeowner pays their property taxes, it's a certain amount of money goes into the fund that funds Easy Does It, and it's a consumer-driven organization similar to what RIL does, except that they just do those services. So yeah, Lisa, we have talked about how we could leverage some of our, I mentioned earlier a little bit about Quick Match. We're not quite ready for this yet because we just started with Quick Match, but Quick Match could be a way for us to provide a backup list of attendants, or another way of saying that is caregivers, PCAs. Or I know I'm not saying that to you. I'm just saying that for the group. So I think that in order for us to create like a really good backup system of caregivers and a backup system for wheelchair repair, we're going to have to really have some strong public and private partnerships to be able to do that, and advocate for a consistent stream of funding to be able to do that. So I think that's a couple of years out. For example, I would love to have a wheelchair repair program on site, but because I used to run Easy Does It, I know that if we don't have a person on site who knows how to maintain the chairs are just going to sit there and not be sent out into the community. So I'm definitely open to, the idea of doing that. And I think our board is too, but it's going to take some planning and some lifting to get some more public and private partnerships to get the funding, because that's how Easy Does It is able to do their job, is they have that steady stream of funding.
From the city of Berkeley.
Yes. From the
Great.
Property taxes. Yeah.
Great question, Lisa. We did have a question on April. Are there going to be, or do you anticipate some budget impacts on your agency or other impacts that you're anticipating to other agencies or other services in California this year?
Hi, Jeff. Oh, and by the way, Jeff, I'll give a shout out to Jeff. He asked the question and he's on our board. So
okay.
He's the treasurer of our board. So yes, so in the May revise, there is a proposed reduction in independent living centers. And that doesn't mean that that's going to happen, because that's just the May revise. So we have time to advocate against that. I think that, some of the reason for that is because we received CARES Act money, there's a perception that we can backfill some of the cuts, but the CARES Act money is very specifically defined what we can use it for. We can't use it for our other core services. So if we do that. I don't know, what ultimately is. We've weathered storms, before, but there is a proposed general fund cut. Some of the funds that we receive comes from the California's general fund, and that's what they're proposing to cut because they know that we receive CARES Act funds, and so we're just advocating that the CARES Act fund has nothing to do with what we were going to use the general fund money for in our other core services. So it's not definite yet, and I'm still getting a lot of information, so it's hard to say what the impact is going to be and what we'll have to do. And hopefully what we can do now is take this time to advocate that we don't want to have any cuts because the services are needed, more than ever. And we want to continue to make sure that we're showing up for the community, because if there was ever a time where, peer-driven disability services are needed, it's now. So.
Great. Kathy, is there any other questions in the chat that I've missed or April's missed, because she's good at checking over there?
I know that Nancy Libby, who's in South Lake Tahoe, was wondering, Jody had offered that PIRS is located in El Dorado County. So it looks as though Jody answered Nancy.
Yeah, they're in Auburn, but they serve El Dorado and Alpine counties also, and Placer.
And Placerville.
Nancy, I see your question about a family member who has a visual impairment. She should definitely contact Sacramento Society for the Blind. And I'm not sure if there's an equivalent. Do you know, April, in other surrounding county, or maybe Raymond, do you know in Placer County? And Lisa, I'm going to put you on mute. Or somebody else is making some. Maybe Jeff. I'm going to put you on mute. Okay. Thank you. So any other? Nope. Sound is still there. Anyway. Any other resources for people with visual impairments in Placer or Sacramento County? That person lives in
Society for
Roseville.
the Blind is also statewide. They have a huge service area. They're just based in Sacramento, so they could call Society for the Blind. We work really closely with them. So if someone does, I will say though that if someone does call us who is blind, a lot of times what we'll do is we'll coordinate services with Society for the Blind. So they might get something from our library, our loan library, that maybe Society for the Blind may not have access to. I know we helped someone a couple of months ago with a Braille reader, but then they also were connected to Society to take some of their career classes. So there's a way that we can all work together. Like, I don't believe in working in silos. So,
Great.
Yeah.
Thank you. A little bit farther up, we had Gino with DRC Inc., and I'm not familiar with that group. Gino, where are you located? He's putting his headset on.
Oh, yeah.
We are located in beautiful Southern California, Long Beach.
Long Beach.
Can we come visit?
Absolutely. There's always room for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Yeah, there are 22 of us.
There's always room for 22 more.
Great. And you mentioned some of the supports that you provide, peer support, transitional youth coordinator,
Right.
living skills. So are you a vendor of the regional center, or are you a ILC in that area?
We're an ILC. We're an ILC. So one of the reasons I was late, I was just on a Zoom meeting with my students. So I work with all the transitional youth group, peer support, and independent living skills. That's what I do. So I know we meet at least 4 times a week with my transitional youth group, and I usually work with all of Long Beach Unified School District. So that's always a big thing for me. We've been doing this for the last 3 years, which started off with our summer youth and advocacy group. Now that we go year round, it's just called Go LBC, which is Get Organized Leadership Beyond the Classroom. So like I said, I'm lucky that I've been with the school district for the last 3 years, assisting with independent living skills and peer support.
Thank you. We're pretty much out of time, and I always respect everyone's time. So thank you for joining us. I wanted to just ask a final question, and thank you all for your extensive registration questions. That helps us for our surveys that we need to complete for the federal government. That helps fund our agency. I just wanted to do a quick show of hands, or if you can put your hand up in the chat box or on your screen and just say whether you learned something today or you're satisfied with the activity. Hand up. Yay, I see thumbs up. Come on, Deirdre. All right. All right. Thank you. Well, I know I learned a lot, and I appreciate all of you. Erica says she learned a lot. So thank you all for being here. And I wanted to let you know that next week is Diana Maffei from Warmline Family Resource Center. So that should be a great discussion. And then I'm working on like the next 8 weeks. So if you know somebody that you would like us to have on as a guest, let me know. And we will continue these as long as people are interested. So thanks. It was great to see you all. Thanks so much, April, for your time.
Absolutely. Thank you for inviting me. Anytime.
Thank you, April.
Thank you, April. Thank you, Sonia. Thank you, Kathy. It was very,
Yeah,
very
thank-
informative. Thank you.
Thank you, Mina. Okay, everybody
Thank
have a
you,
great
Mina.
day.
Bye.
Bye.
Bye-bye.
Thank you.